Okay. Can I get your names first, just for full spelling?
King Chung or Dr. Chung.
So it's Kinchung.
Yeah,
And I'm Gina Manella, so GinaMannella.
Okay, the lead position, and what's your job title?
I'm the executive director at the Prime Care Family Health Team.
All right. Just just tell me a little bit about the vaccine clinic. How long, when is it running, the hours?
Okay, so we
how do people book the appointments?
Sure. So we just started. We got permission from Public Health to start a COVID vaccine clinic here in our family health team. We started last week. Kind of a soft rollout to make sure that we were adequately equipped to provide vaccinations to our patients.
Okay.
And we recently got the okay from the ministry that we could expand into the community. So we've been working very diligently in terms of reaching our patient database, spreading the word, telling them that anyone age 40 plus can come in to receive an AstraZeneca vaccine. We're also reaching out to local manufacturers and retail businesses, large ones, to see if we can accommodate on-site vaccination. We're actually going to Roxhill today, which is a large manufacturing plant, to see what we can do to help immunize their essential workers, their shift workers. And we're launching a social media campaign to spread the word throughout the community.
Okay. Who is this aimed at? You were talking about the workplaces. In the community specifically?
Yep, so we're basically targeting anyone within the community who's over the age of 40. We don't have restrictions with respect to where they live. So we're happy to accommodate anyone in Milton, surrounding cities, and if need be, anyone who's willing to come in to drive here to have the vaccine. So we've been asked to redeploy all our resources by the Ministry of Health to accelerate this program, make sure we can get as much vaccine into the public as possible. I think our capacity is 120 vaccines a day is what we're looking at. We have, or 170 is what we have spots for.
Sure.
Okay. I understand from talking with Jen that it's the AstraZeneca. Talk a little bit about that, because there's been a lot of controversy, a lot of fear. I just sort of would like to kind of push back against that and see if we could calm the fears out there a little bit.
You talk about that.
The way I talk to my patient is go to the website, Canadian data, the thrombosis.canada.ca. They talk about blood clots across Canada. For patients are healthy, there are 1,920 cases a year across Canada. For young women taking birth control pills, it's 900 per million per year. Taking AstraZeneca as of today is 4 per million. So you see the difference. Yes, there's a tendency to form clots. The mechanics hasn't worked out yet, but the number is very small. It might go up with more AstraZeneca vaccines, but to me, put in perspective, it's not a major concern.
Okay. So a bigger concern, and the stat I think with COVID is it goes once you're admitted to ICU, 1 in 5. Is that right?
Very high.
Yeah.
Yes.
Correct. So I encourage patients look at the Canadian data, make an informed decision.
I think it comes down to the benefits outweighing the risks, and I think people really do have to put those numbers in perspective. I think what's been detrimental for this rollout a lot of the time is the magnification of such a small percentage. I don't think, but we don't talk about other things. So we don't talk about the chances of being in a car accident. We don't talk about the chances of getting a blood clot from birth control pills. So it's really about putting it into perspective and leaving the choice up to the patient. I think that's our most important. But we are following. It's an approved vaccine from Health Canada. It's been used in the UK extensively. We've administered millions of doses here, so we are encouraging people to get the first vaccine that's available.
Okay. What are some of the side effects that people can expect other than?
Just like any other vaccine, the site of injection could be red, hot, swollen, little fever, little chill, and those are all self-limiting. Expect to last a day or two, sometimes even up to 1 week. fatigue, no energy. Those are part of the side effect of the vaccine.
And I would say that's across the board with
Yes.
Yeah.
any of the vaccines available.
Okay. How long are the vaccine appointments? Like,
So right now we
Typically.
have, we just opened capacity, so we are able to accommodate, like I said, 170 vaccines a day. We're running this till May 31st, until we hear otherwise. It may be ongoing, it may not. We take our direction from Halton Public Health, Halton Region, and we take our direction from the Ministry of Health. So we've been asked now to have this be our main goal, and I think what we've done is we've opened the schedule until May 31st, from Monday to Thursdays. We're running the clinics here out of the office,
yeah.
and we're running them from 9 to 4. So there are quite a few appointments available currently, just because we just opened it up. So we're encouraging everyone to call in and book.
Okay. Is there?
Oh, Jen.
Okay. So how can people book appointments?
Okay, so in a lot of our social posts and our newsletters and on our website, we're encouraging people to call our family health team main number. So that is 905-878-1720. So they can reach out to us that way to book the appointment. They can also email an appointment request to COVID-19vaccine@primecarefht.ca. So those are the two ways, and like I said, someone will get back to them within 24 hours. That's our goal. And at this point in time, we do have a lot of spots, so we encourage people to contact us either way, by telephone or by email.
Okay. Thanks very much.
Thank you.